This is the pelvic ultrasound study of 34 years old Paris female with history of menorrhagia. Now this is the urinary bladder in longitudinal section, uterus measuring 10.5 centimeters in length and 4.4 centimeters in anterior-posterior diameter, anterior myometrium, posterior myometrium. This is the cervix, and there is no pathology seen relating to the myometrium. Now this is the endometrial canal. This area is representative of endometrial canal. It is central, clear, and in late proliferative phase. Now this is the longitudinal section. However, this is the transverse section of the uterus. Measures 5.8 centimeters. This is the right ovary. I'm going to magnify. Left ovary. Trying to get a better view. Here we are. Now this is the right ovary, and this is the left ovary, and this cystic area within it is the dominant follicle measuring 15.4 millimeters. When I move the probe towards the right atinexa, we see there is a well demarcated echo-filled cystic area, thick echo, very thick echoes, with a central echogenic area, dense course with no posterior shadowing at all, measuring approximately. Now this cystic mass on the right side, in the region of the right atinexa, measures approximately 34 millimeter by 32 mm, and there is a central echogenic. This central echogenic area is the solid element within it. Now this finding is consistent with some benign. Let's magnify teratoma in this patient. Now this is the uterus. I have magnified the view for a better explanation and for a better understanding of this cystic mass, and you can see there is small amount of fluid seen on the medial margin of this cystic mass. Well, this is the cystic mass. And echogenic area. This is the dense coarse echogenic area with a few tubular hypoechoic areas within it, measuring approximately 15 into 11 mm, and we do not see any calcification within it. And this is the anterior wall of the cystic mass. No posterior wall acoustic enhancement is seen. Why? Because such a thick debris is seen, which is not allowing the waves to travel through this cystic area with speed. This cystic mass measures approximately, in this scanning plan, 31 by 32 millimeters. This is the uterus, a transverse section. This part of the uterus is seen in this view, and this is the cystic mass with solid element within it, and this is the solid element with no posterior wall shadowing. in the cystic mass in itself there is no calcification seen, and this is the urinary bladder, this area, and this is the transverse section of this cystic mass. Now let's go back to the normal magnification. Right ovary is not seen, so this is relating to the right adnexum. See, there is small amount of fluid. This is the uterus. This is a small amount of fluid in the region of just medial margin of the cystic mass. Now, one thing to see is important is to see whether it changes, this cystic mass changes its shape or not when I sweep the probe about 180 degrees. Here we are. So we see it retains its shape, it does not change its shape. Now back again 180 degrees. So there is no significant posterior wall acoustic enhancement seen, and this cystic area. Now here in this, from this angle we can see a little bit of shadowing from this echogenic area, dense coarse echogenic area around the cystic mass, predominant cystic mass with no posterior wall acoustic enhancement. And this is a case of benign teratoma in this young female in reproductive age. This is the longitudinal view, and this is the uterus. So this is our case of the day. Thank you very much.